Dengue fever, a rising concern in Southeast Asian countries. The news article that caught our attention was published by the CNN titled, Singapore's Dengue Emergency is a Climate Change Omen for the World, written by Heather Chen. For those who aren't familiar with dengue, it is a disease that is transmitted by the bite of Aedes mosquitoes. Chen mentions in the news article that people with dengue fever may experience flu-like symptoms such as headaches, body pain, and in severe cases, bleeding, organ failure, and death. Cases are most common in humid areas such as countries in Southeast Asia. To name a few mentioned in this article, there are a pressing number of cases in Singapore and in the Philippines. So what is the importance of dengue for nurses and other healthcare professionals? In our news article, Chen provides statistics recorded by the World Health Organization that in 2019, there had been 5.3 million cases worldwide and outbreaks in over 100 countries. Specifically in Singapore, May of this year, the Ministry of Health recorded 11,670 cases, with 10% in need of hospital care. Words from a scientist, Winston Chow, expresses the condition of dengue in Singapore, saying, in terms of adaptation, Singapore has excellent healthcare infrastructure and countless policies in place to reduce the risk. But there's only so much that it can do. And from another official, Desmond Tan, Singapore's Minister for Home Affairs, addressed the rapid increase of dengue and urges action. In the hospital, healthcare workers in Singapore are approaching the increase of cases by applying clinical management of the disease and clinical suspicion when encountering patients with fever. In the news article, Chen lists measures taken by the Singapore government in effort to decrease the outbreaks of dengue, such as island-wide fogging, public awareness campaigns, and the use of lab-bred mosquitoes. But despite said approaches, dengue fever cases continue to rise. With the impact of climate change, not only are cases rapidly increasing, but spreading outbreaks to warmer areas such as newly confirmed cases in Afghanistan. And although it is considered as a seasonal disease, cases in Singapore were reported earlier than expected due to humid weather in the country. The change of warmer weather provides perfect breeding conditions for mosquitoes, in turn causing more victims. Winston Chow shares to CNN that due to extreme weather, dengue disease cannot be eliminated as a whole. Therefore, it is important for the healthcare system to maintain the health of the community.
All right, so the first article we looked at was about the health impacts of infectious diseases, including dengue, on low-income migrant workers in Singapore. This article is a literature review of articles about migrant health from the past 30 years. The researchers found that transmission of dengue is mostly through occupational exposure, behavioral exposure, or through infection when migrant workers were visiting their home countries. They also looked at some of the government policies that are in place to mitigate dengue outbreaks, and they came to the conclusion that dengue disproportionately affects migrant workers. They are at a higher risk for infection than Singaporean citizens are. This is due to essentially language, belief, and cultural barriers in combination with economic and power disparities. The researchers recommend a couple of policies in order to mitigate this disparity, and note that these approaches should be culturally appropriate to the people they will be affecting, the migrant workers. They recommend improved transmission surveillance, more robust preventative measures, and a decrease in barriers to accessing healthcare services for migrant workers. The next article we looked at was about how nurses' knowledge, attitudes, and practices can affect dengue patient care in Thailand. They looked at 94 nurses across 94 PCUs, which are bridges between community and hospital care and are staffed entirely by nurses. They used questionnaires and focus groups in order to better understand the nurses' opinions and factors affecting the delivery of care to patients with dengue. They found that 78% of nurses had poor knowledge level in regards to dengue patient care, 78% had poor attitudes, but 90% had good practices, which they concluded meant there was no relationship between knowledge, attitudes, and practices. They recommend community participation in the development and use of care guidelines, as well as the implementation of workshops in order to achieve continuing competence and bridge the nurses' knowledge, attitudes, and practices in order to better or to improve prevention, control, and treatments of patients with dengue.
In determining our philosophical approach, we use the critical social theory to explain the article's health concern by identifying and resolving issues with power relations and political thinking. So, by monitoring mosquito-borne dengue fever in order to maintain population health in Singapore, political parties must take into account the marginalization of migrant workers who are more at risk. It seems that there are linguistic, cultural, and financial divisions among persons who are more vulnerable to particular viral agents. For instance, Article 1 notes that men working on construction sites experience occupational exposure. For migrant workers, traveling home can expose them to infectious diseases, and those who reside in dorms or crowded living situations face behavioral exposure. Given that Singapore is encircled by the South China Sea and the Indian Ocean, cultural shortcomings should also be taken into account. The result is a warmer climate throughout the nation, as more people will contract dengue disease as mosquitoes become more common. Since these factors are limiting the increasing economic burden, it is important for people living in or out of these conditions to address the unequal power dynamics. Lack of health insurance coverage has an impact on health-seeking action when it comes to accessing treatments as well. And then for health promotion sessions, they should be periodically held at public institutions, particularly in the neighborhoods of migrant workers, to improve the quality of life in their community. Pre-employment testing, vaccine policies, and improved transmission surveillance are all appropriate approaches to help combat dengue fever in Singapore. These recommendations could ultimately improve divides when accessing healthcare. The origins and indications of dengue should also be communicated to the common people. For example, using insect repellent, lining sleeping spaces, and staying indoors between nightfall and morning reduces the chance of illness and therefore should be done. The political engagement of Singapore should continue to look for just solutions for people who are more or less susceptible to these safety and health requirements, and political advocacy should be considered as the temperature of our planet rises.
Some cultural considerations that we keep in mind in Singapore is that during and after the rainy season, a lot of people are hit. So during this time, there's so many diverse cultures. So we have Chinese, Singaporeans, Malays, the Indians, Eurasians, and Westerners, and they all live in different type of living conditions. So if you live in a poor living condition or have low income families, you do get affected more in this time. So also to keep in mind that in Singaporean culture, there is the mindset of familialism where families take on most of the work for those who are ill. So rather than leaving it to the hands of facilities or a professional team, they do these things at home, make these decisions at home, and taking the holistic approach and caring for their families. So these can come into to play when they need better health care as well. So when you look at the privileged and marginalized groups, although Singapore has excellent healthcare system and policies in place to help the risk, not everyone has proper healthcare. They don't have that access to proper healthcare. And we look into migrant workers where they are working on lower wage, unskilled work permits. These people from Bangladesh, India, Malaysia, they all get hit as well. So looking into discrimination, unequal pay, benefits, or working conditions. Also, men and women who have HIV or AIDS are often excluded from consideration of employment as well. Taking a look into the background of it, due to the history of British colonization of Singapore, once they gained their independence, they made sure to kind of Asianize everything with their policies, which favor Singaporeans and their locals as well. And in Thailand, there's a divide between the white migrants and the local Thais, where Western migrants have better access to resources and medical care, stable lifestyles, where local Thais are marginalized and due to their language barriers and financial status.
It is really important to take prompt action when providing care to patients with dengue fever, as patients with dengue can die from a delayed diagnosis. Some possible actions that nurses can take to provide care to patients with dengue fever are to do initial assessment by screening for dengue infection and assess for patient's body temperature, blood pressure, and respiratory rate. If the patient has fever, the nurses can recommend patient to take paracetamol instead of aspirin to reduce fever and to drink plenty of fluids. Also, nurses can assess for shock symptoms. For example, if patient is not drinking but experiences excessive thirst, little to no urination for 4 to 6 hours, restlessness, abnormal bleeding, cold feet and sweating, fever, and no improvement on symptoms, then there's a high chance that patient is experiencing shock. Then nurses can provide IV fluids to manage the initial shock and then refer patient to a tertiary hospital for further care. Nurses can also educate the public population by providing advice regarding prevention of mosquito bites by wearing long sleeves, using insect repellent, encourage the destruction of Aedes species, breeding every sites every week in communities, and help practice the preventative measure because prevention is the best treatment of dengue. Hopefully you guys enjoyed our presentation and learned something from us. Thank you for listening.